I'm Mantu Gupta, and I'm the Director of Endourology for the Mount Sinai Healthcare System, Chairman of Urology for Mount Sinai, Roosevelt, and St. Luke's Hospitals, and starting a kidney stone center for Mount Sinai Healthcare. One thing I pride myself on is treating the entire patient and not just the particular problem they came to see me for. A lot of patients who have kidney stone are going to have another one, so it's not an isolated event. And some patients will go to the emergency room, be diagnosed with a kidney stone, pass it at home, and then never bother to see a urologist. And it turns out that when they were in the emergency room, they had a CAT scan, and it wasn't just that one stone, but there were several other stones in the kidney that they didn't know about. And so by not seeing a physician to follow up on it, they'll never know that that's there. And kidney stones, even though they may be silent, can be very harmful because they can cause silent obstruction of the kidney, and the kidney can start failing if it's not treated in a timely manner. But the vast majority of patients, it is 100% preventable, either by monitoring their diet and changing it, or by starting them on a vitamin or mineral or medication. And I always pride myself on trying to do the least invasive medical treatment as well. Sometimes just by looking at the x-rays, I can figure out that this is the kind of stone that doesn't need surgery, can be dissolved, or can be expelled naturally, and I'll start them on medications. It's surprising how many times the patient hasn't been put on medication already for that, or how many times they've had these stones over and over again and no one's put them on medical therapy. But if it does come to needing surgery, I try to do the least invasive procedure that's going to take care of their problem. Sometimes that's a shockwave lithotripsy, sometimes it's a endoscopic procedure with a laser, and sometimes it's percutaneous renal surgery where you make a little keyhole incision in the back, go into the kidney, and remove relatively large stones by fragmenting them and taking the pieces out. And that's where my expertise comes in. And all our staff, our fellows, our nurses, and are trained to take these patients through the whole process of having surgery and make it easier for them. Just treating the kidney stone, removing it, is not really taking care of the whole situation. And so it's going to take a team of people. Sometimes it's a kidney problem and I send the patient to a nephrologist. Or it's a bone disorder that's causing too much calcium to come into the urine, and that's why they form the stone. And so an endocrinologist needs to be involved. But instead of sending patients to a nephrologist and then having them come back and see me, then an endocrinologist who sees them and sends them back to me, or a nutritionist who tells them what they should be eating or not eating. My thought was, why not have it all together in one center, a kidney stone center, where all the expertise would be in one location and the patient wouldn't have to go shopping around for those opinions. Then they would get more holistic care in terms of treating every aspect of their kidney stone problem and their other medical and metabolic problems, and get it resolved much more quickly and comprehensively. I'm inspired by the people around me and to try to always do something better than it's already out there, and that's been my reputation always. So a lot of patients who get referred to me have complex situations, have had other procedures where they didn't work, and they just need the expertise of someone who is very good at trying to find innovative ways of treating them. And that's always been my driving force.